Inserting the IPG probe into your ventral hypothalamus. Give me 3 volts.
Wait, incredibly dangerous procedure. There's only 3 people there, and one of them is the patient. Where's the anaesthetist? Where are the nurses? I also love how Chase is a subspecialized neurosurgeon now, when earlier in the episode he was a cardiothoracic surgeon. His malpractice insurance must be the GDP of a small country, which could be the UK soon, the way the pound is going. Welcome to the last of the 2-part series finale, Wilson's Hearts, with the first part being House's Head. If you haven't seen that episode, go watch that first, because I don't want you to see the spoilers in this episode. Otherwise, make sure to watch this episode till the end, because as always, there will be an epic twist, I'm sure. But let's get right into it.
Her heart won't stop racing. No idea what's causing it.
Sure it wasn't the bus that landed on her?
It's not trauma. She was stable post-op. This didn't start until an hour ago.
My God. Delayed reaction to the trauma. She lost both her kidneys in the bus crash. Ripped up her femoral artery.
So basically she's got a fast heart rate. They don't know what's causing it. And there are a few different options. It's a little bit strange that the fast heart rate started an hour after her surgery. Makes you think that could be something like a fat embolism. She had a fracture of one of her long bones, and in 3 to 4% of cases you do get a bit of fat that gets dislodged from one of the blood vessels, can go up into the lungs, and that can lead to a fast heart rate, but also multi-organ failure and severe neurological deficit. Usually it needs intensive therapy, so basically heart and lung support with a ventilator, as well as dialysis if you develop kidney failure, until the body has a chance to recover on its own. There are also some other options at this point as well. We haven't really been given much, so let's watch more to find out more clues.
Got her on dialysis for the kidneys. Whatever's doing this to her heart, it isn't from the crash.
Check her potassium?
Of course.
Why didn't you call me?
She's been under the whole time. She had no ID.
Pushed adenosine?
And verapamil. And floated a Swan an hour ago.
Coronary angiography.
3 critical patients ahead of her. Will have her in within the hour.
Oh, so that's really interesting, because the ECG on that monitor is showing ventricular tachycardia, which explains the abnormal rhythm. It's not just that there's a fast heart rate. That's actually very severe, and it needs urgent treatment, usually with things like amiodarone as an initial drug. And if that doesn't work, it's so severe that you would actually shock the rhythm, because it can lead to her arresting. So I would definitely not be talking calmly at this point in the way that they are. I would be acting ASAP.
Angiography.
3 critical patients ahead of her. Will have her in within the hour.
We're 15 minutes away from Princeton Plainsboro by ambulance.
You want to move her? Her heart rate is 130.
She's hemodynamically stable. We're moving her.
What? Okay, so first of all, he said she's hemodynamically stable, which clearly she's not. Her heart's going way too fast, and she's in an unstable rhythm that could cause her to arrest at any point. That's number one. Basically, the second is that by the time you actually referred to the second hospital, got the patient there, and managed to get a spot in the cath lab for an angiogram, you could have just waited for the slot that she already had in the same hospital, in real terms speaking. But I think Princeton Plainsboro is where they actually operate from. That's like their base, so maybe they just want to bring her close to home, which is fair enough. Not feeling very comfortable about this transfer.
I'm barely coherent. I need your help right now. VFib!
Wait, that's not VFib. Let's get that back on the screen. VFib basically looks like a bunch of squiggly lines on the screen. Not like that. That looks like sinus tachycardia, where it's like lots of narrow batches squished closely together. VFib is basically where your ventricles inside your heart are totally unsynchronized, and they're not even beating as whole units anymore. They're actually just having little small contractions or spasms in different areas, and so they're not actually pushing the blood. So when you try and feel a pulse, there is none because there's no pump. It's interesting because this episode's called Wilson's Heart, and they're not doing well with the heart traces so far, although rare misstep for House because it's usually fairly accurate.
Claire! Wait! Protective hypothermia.
Want to freeze her? Her heart's not beating.
You restart it, it'll keep racing, shoot off free radicals, and kill her brain. We ice her down, put her on bypass until you've diagnosed her.
This is actually a real thing. It's amazing how when you cool the body right down, it actually preserves the brain function really well, even if the heart is not beating at all. We get a lot of cases like this in a hospital. For example, when I was on heart surgery, we had a patient who was brought in that was found in a river. No one knew how long they were in there. When they found the patient, the body was cold. They started doing CPR and they brought the patient, who was a really young 21-year-old girl, into hospital. They tried doing CPR for about an hour, were not getting any pulse back. The patient was still cold, even though they tried to re-warm them. And so they called us as a cardiothoracics team and asked, shall we call it? Because as is the protocol for patients who are hypothermic. And we said, absolutely not. Do not call it. We're going to take her to theatre. And we put her on a bypass machine and basically slowly warmed her body up until it was back at 36 degrees Celsius. And she woke up. Her heart started beating. Her brain was functioning. We took her off bypass. She left the hospital 2 to 3 days later without any permanent disability whatsoever. So you have to be really careful when someone is hypothermic to announce that they have actually died, because a lot is reversible in terms of brain function.
Core temperature down to 90. Bypass circulating. She's stable.
Stable? She has a machine breathing for her. How is that stable? Maybe you have to be a little bit more careful with your choice of words, Chase. But bypass is actually quite interesting, and what we're capable of has totally changed since the bypass machine has been invented. You know, recently in the University of Maryland, we had a pig to human heart transplant, which is called a xenotransplant, which was the first one ever successfully performed. Unfortunately, the patient, David Bennett, actually passed away about a week after the transplant was received. But that's a huge breakthrough, as there is a massive problem with the amount of donor hearts available compared to those who need it. And that's why patients who need a longer term support and have heart failure are actually being given artificial hearts now, but they really don't last too long. The longest an artificial heart has lasted for is around 4 years, but a lot of research has gone into developing new types. Previously they had like a bladder which would fill with air and replicate the heart. But now they're coming up with a lot more innovative techniques, and some people are using more whirling circular mechanisms to do it. So in the next few years, we may actually be able to create an artificial heart that replaces a human heart, which would be mind-boggling.
What did we do last night?
Is that meeting you for a drink?
Is that all it was?
They say your libido is supposed to reduce with age, but for Dr. House, that does not apply. But somehow, from his fantasies, he seems to be able to diagnose patients, so it's justified.
What do you feel? Electricity.
Deep brain stimulation. It's been proven. Electrical impulses applied directly to the hypothalamus can evoke detailed memories.
So, deep brain stimulation is a really interesting neurological procedure. I've actually seen it done. It takes about 12 hours or more to get the probe in, and then essentially you have to channel the controller all the way down into the thorax as well, through the neck. And it provides the patient with repeated electrical impulses to a targeted area of the brain that potentially is causing them problems. So if that's epilepsy, it could be in the epileptogenic area, or if it's Parkinson's disease, it could be in the place called the substantia nigra, which basically recreates the effects of what dopamine would have been doing, but since it's now lacking, the electrical probe is producing those impulses and stops the person from becoming really rigid as they usually would in Parkinson's, and also relieves their tremor. So there are some insane videos of people who have their probe switched off and their tremor is extremely debilitating, and then they switch their probe on and suddenly the tremor's gone and they are magically cured. These things are really groundbreaking. Now, I haven't heard of a probe that's been used to help evoke memory. That doesn't seem to exist in the real world, but maybe it will soon. It seems like things in TV and in film tend to predict changes in the future in real life as well. So could this be the next sci-fi thing of tomorrow?
Found these in her apartment. Sorry. Prescription diet pills, SSRIs, amphetamines.
Diet pills cause structural damage to the mitral valve, could explain the tachycardia.
See, this is interesting because a lot of the times as doctors, we actually don't know what medications people are taking because we're limited to what they tell us. So even though we don't go searching people's houses for the answer, sometimes we find it because of more upsetting reasons. Like, for example, when I was on cardiothoracics, we had a patient who we operated on, and then after the procedure, he just wouldn't wake up. Nobody knew why. Everything had gone smoothly, and it was probably about 3 to 4 weeks later, and we had found out from his family at that time that he was taking this mysterious Chinese herb for every day of his life, and then suddenly when he came into hospital he had stopped taking it for all that time, and we tried giving it to him again, but it seemed like the damage was done and he'd withdrawn from it and would not wake back up, and that was really the only thing that we could think of. All of his other blood tests were normal, there was no signs of infection, and unfortunately he did pass away. So always tell your doctor what medications you're taking. It can be the difference between walking out from a procedure unharmed and more serious consequences.
Test her heart without starting it. Crack her chest open, reach a finger inside the pulmonary vein, run it across the valve.
What? Even for house, that is a ballsy move. It looks like he can basically do whatever he wants in the hospital. Nobody's going to stop him most of the time, but usually it ends up being the right thing. You would also think the original doctors would have checked her ECG and echo while she was still awake, when they had 2 days to be able to look at it. So they would have picked up any abnormal rhythms or any abnormalities with the valve that they think could have been caused by these diet pills. So it doesn't seem like it's that necessary to stick your finger inside her heart. But who am I to question?
Wait. Look at her eye.
She's jaundiced.
Her liver's not working.
Diet pills don't kill the liver. Put her back in ICU.
This is really interesting because liver failure turns you yellow, basically by the liver not being able to clear certain pigments from the actual blood, and they then get deposited in your skin and cause that discoloration. Most common causes of liver failure are things like viral hepatitis, alcoholism, as well as fatty liver disease is a huge problem. So basically patients who are overweight or have diabetes that's uncontrolled are more likely to develop fatty liver disease. So this kind of changes what could be going wrong with her, but it still looks like it's multi-organ failure. She's got liver failure, heart and lung failure. Her chances of recovering from this realistically are very, very, very small, even after weeks of intensive therapy. And the reason why that is actually having all of these things together, especially including liver failure, means that your prognosis or your chances of survival are worse than even the most aggressive cancers. Once you have liver failure, the chances that you survive to a year, if it's severe, are usually around 50%, which is basically worse than pancreatic cancer, which is the most aggressive cancer. So the only treatment really for that, it would be getting a liver transplant. But for that, the cause needs to be known. Otherwise, how do you know that your new liver is not just going to fail like the old liver did? And also, you know, for example, if your liver failure was due to alcoholism, they need to know that you've stopped drinking before getting a new liver. So the pressure is on house to figure out what's causing this. Otherwise, time's going to be short.
Did you see me here with a tall blonde woman?
Yeah, I think she joined you after Scotch number 7.
Did she seem sick?
She sneezed. I gave her a napkin.
Did you see the color of the sputum?
Yes, House. The barman pulls late shifts in the clinic, so he opened up a tissue to check it out. Of course he didn't see the color. See, the reason why the color is important is because the type of pathogen changes the color, and also, you know, if there's blood in it, can also change the potential different causes of that sputum as well. So it's very useful. If you do get some snot and you sneeze it out, make sure you look at it. I know it's grim, but it helps us out.
Tell me that the liver biopsy showed infiltrates, minor inflammation.
Yeah. How?
Snot on a napkin. At the heart, infiltrates. Hep B. Start her on IV interferon. I'll go tell Wilson.
It's hepatitis B virus that causes liver disease. You can get exchanged through body fluids and contaminated tissue during exchanging of blood, as well as having sex. Health workers are at much higher risk, so that's why they get vaccinated, but that's really only about 90% effective at stopping you from getting hepatitis B, and you're much more likely to get it if you're in sub-Saharan Africa or Southeast Asia. There used to be many cases. Now, usually most cases are actually clear, but a small percentage go on to develop chronic hepatitis B and liver failure. That previously was something that could only be managed with medication that would be lifelong, but now they've got new treatments that are able to cure, that's right, cure chronic hepatitis B infection and prevent it from needing medication at all in the future. Certain symptoms can be fever, fatigue, weight loss, diarrhea, loss of appetite, nausea, yellowing of the skin, having dark urine, pale stools, and you can diagnose it by checking for certain antibodies to the virus in the blood test, and you can also actually detect the virus itself. So if you have any of those symptoms, specifically if you've been abroad, then make sure to see your doctor. There are other types of hepatitis that you can get from also drinking contaminated water sources, like for example hepatitis A, that causes a much shorter condition and can mimic the exact same symptoms. But it's always worth getting checked out if you are turning yellow.
She's bruised. Why is that significant?
Look closer.
Rash. How'd you know what was on the small of her back?
Well, either I'm still asleep, I'm starting to remember.
Ooh, so that bruising on the back associated with all those other organ failures can be a sign of a vasculitis. That's basically where the small blood vessels in the skin become damaged and they cause this bruising effect. It can cause heart failure, liver failure, kidney failure, bleeding from the chest, and even small aneurysms in the heart. Treatment depends on what type of vasculitis it is, but usually it involves steroids or immunosuppressants. And there are lots of tests for antibodies that you can use to confirm the diagnosis. It could also be something else like a funky infection or a type of Legionella still. But this is getting spicy now with these new signs.
Rocky Mountain spotted fever.
We had dinner with a friend last week. We walked their dogs. I guess she could have gotten a tick.
It's treatable. Doxycycline.
Allow 8 hours for the antibiotics to take effect, and we warm her up, shock her heart.
Rocky Mountain spotted fevers. It's such an interesting condition. It's creatively named Rickettsia rickettsii. It's basically has a reservoir in dogs and rodents, but it's actually transmitted by ticks itself. It's really limited to the Western Hemisphere of the world, so we don't have much experience with it here in the UK, but it can be severe. It does cause a vasculitis type syndrome where it releases this toxin where the bacteria invade the wall of the blood vessels and can cause damage there, and that can happen all around the body. The classic thing is that you start getting fever and headache to begin with, and you develop symptoms about 2 to 14 days after the rash. If it's untreated, up to about 30% of patients could actually die from Rocky Mountain spot fever. So it's very important that if you get a tick bite, you basically see your doctor before it's too late. After the initial symptoms, you can sometimes get a rash, but that rash isn't necessarily on the back. It usually is around the legs or the wrists, and then it can spread to the chest and possibly involve the back as well, but that's more at the later stage once the rash is affected elsewhere. So this isn't really a classic case. I don't expect that this will be the final diagnosis, even though they've seen that it is. Usually the test isn't to culture it. That takes a little bit too long. It's actually to find the antibodies to the Rickettsia rickettsii bacterium, which is a much faster test. So let's see what happens.
We are not starting her heart until we're 100% certain.
We're never 100% certain.
You see, a lot of people look for guarantees when, we're giving diagnoses about certain conditions, like, is it definitely this? Will this operation definitely work or cure my problems? And I can understand why, because a lot of the treatments we give have significant side effects, especially when you're doing the more invasive things. But you just can't give guarantees in medicine because we are never 100% certain, as Foreman actually said. And if we promised people that we definitely knew, then I think people would lose faith in the medical profession when things inevitably don't go to plan, which they do very frequently. Although more frequent for some than others. But that's why a lot of people are turning to alternative medicine practitioners, because sometimes they are more likely to give these guarantees. Like, if you are a cancer patient and the doctors are saying, well, there's a 10% chance that this extremely aggressive chemotherapy is going to cure you of your cancer, but it's 100% chance that it's going to make you feel like you've been hit by a truck, then you're going to start looking at other options. And when you find alternative practitioners that can say, I can heal your cancer by alkalinizing your blood, then that's probably going to go for it. The line for me where things get dangerous is when people start pursuing those treatments in exchange for the medical treatments, and then they give up on the treatments that actually have scientific evidence for working. So, you know, I have nothing against alternative medicine practitioners who want to supplement traditional medical therapy, but not as an exchange. So if anyone actually tries to sell it as that, then they really are a charlatan, and they will just try and keep your money and not care what happens to you in the long term.
Run the blood cultures. After we get confirmation, we'll restart our heart.
And you know he's wrong. You can't change your mind just because a family member starts crying. They're always scared.
I said, run the blood cultures.
See, this is why doctors don't traditionally treat family members or relatives, because it clouds your judgment. You can't properly assess risk when it's someone dear to you, because it's just too personal. You can't imagine the idea of things going wrong. And so you basically can't treat them properly, because there's no way you don't take risk, especially if you're dealing with something serious. Like, for example, there was one time where a father's child kept developing fevers every single day, and he kept telling them, it's okay, we'll just wait. Kept getting a fever every day for about 5 days, 6 days, 7 days, and then eventually became really unwell and had to be rushed to the pediatric emergency department. And they found out that the child had Kawasaki's disease, which is a rare form of vasculitis that can be life-threatening if untreated. And the child did survive, thankfully, but I think it was too painful for the parent to imagine that the child had that disease, even though they were a doctor. And so they just continued to falsely reassure them, even though if it was someone else, I'm sure the doctor would have seen it a bit more objectively.
What are you doing? She's up to 80 degrees.
We're gonna restart her heart.
Well, you're not. There's still time to undo this. Cool her back down.
You weren't taking the safe approach. We've got to know if the antibiotics are working.
Her EEG slowed. Well done. We still don't know what it is, but you've just let it spread to her brain.
It sounds cruel sometimes, but as a disease progresses, it does give you more clues as to what it is that's going on. And sometimes when you see it too early, it hasn't differentiated itself enough for you to figure out what is actually causing the problem in the first place. Because medicine is based on pattern recognition mainly, and most of that is from the history that guides what tests we order. So if something's uncommon, especially like it is in house, then you probably won't be testing for it right at the beginning. So the science of the vasculitis is still there, but the question is, you know, which one? Polyarteritis Nodosa is actually possible. It's where your immune system basically confuses a part of one of your blood vessels as if it is actually a hepatitis B virus, which causes inflammation around lot of different parts of your body. It gets its name because certain bits of the vessel will die, and it essentially makes the blood vessel look like a string of beads as the bits that are dead dilate outwards when the muscle weakens. So that's why it's called Polyarteritis Nodosa. Interesting fact for you there. As this damage happens, it causes ischemia or reduced blood flow to different organs around the body and leads them to fail, which causes multi-organ failure. And treatment is basically with steroids, which reduce the inflammation of the arteries.
Heart, liver, rash, and now her brain.
Autoimmune fits best. Crash trauma could have set it off. Start her on prednisone, warm her up again.
House, if this is some other infection, the steroids will trash her immune system.
You're not going to test first, House. You have such a fancy lab with all the bells and whistles, but you do not use it. There are so many antibody tests you can use, but the fact that there's 20 minutes left of this episode makes me think I was wrong, and it's not actually autoimmune. So let's see what it is.
You can't do this.
It's not a good argument. It's not an argument at all. I'm sorry.
That has to be one of the most polite displays of anger that I've ever seen. Trash the desk, break the teapot, throw the ball at his head. He had so many good options there, my friend. Bless him, he's so polite. I shouldn't laugh. He's in a tough situation. I'm a bad person. Sorry.
Before you warm her up, you said you wanted to try deep brain stimulation.
There's just no reason. We know the symptom, we know what I saw.
What if it's not the rash? What if you noticed the rash in the ambulance or when we were putting her on bypass? What if there is still something else stuck inside your head?
Deep brain stimulation has been shown to improve memory in Alzheimer's disease in certain areas during experimental studies, but to my knowledge, as I was saying before, never to improve memory in post-concussion syndrome. But yeah, maybe it's doing the sci-fi thing like how Terminator predicted drones with weapons, or Blade Runner predicted huge billboards with advertisements on them inside of skyscrapers. It's a complex procedure. There's lots of risks, risk of infection. So let's see what happens to House. Also risk of damaging neighbouring structures. I feel like I'm consenting you for an operation right now.
Inserting the IPG probe into your ventral hypothalamus. Give me 3 volts.
Wait, incredibly dangerous procedure. There's only 3 people there, and one of them is the patient. Where's the anaesthetist? Where are the nurses? I also love how Chase is a subspecialized neurosurgeon now, when earlier in the episode he was a cardiothoracic surgeon. His malpractice insurance must be the GDP of a small country, which could be the UK soon, the way the pound is going. It might not be so fun for the surgeon, but for me as a patient, if I'm having an operation, I would want to know that that is all that surgeon does, day in, day out. He lives, he breathes, he sleeps, he dreams the operation that he's performing on me. Because, I mean, it's safer that way, isn't it?
Don't do it. It wasn't the flu. It's what she did for it. She has Amantadine poisoning.
Oh, see, Amantadine is an anti-influenza A medication, but it's no longer recommended for treatment of flu because there's just too high levels of resistance. You usually start taking it between 24 and 48 hours of starting the flu, but really it's only recommended for people who are in at-risk groups, like people who've been hospitalized because of it, or the elderly or the very young. So you wouldn't expect a young doctor who's generally healthy to be taking it like she was. But it seems like she was taking the pills at normal level, and then as her kidneys shut down, they became toxic in her blood, and that led to all of her multi-organ failure. Seems like he's cracked it. Very, very interesting. That is niche. I would never have got that from the beginning. I don't know if it can be treated though. I don't think it can. Let's see.
Amantadine binds with proteins. Dialysis can't clear it out of the blood. There's nothing we can do.
I actually just remembered. So there's 2 case reports, I think, of patients who've had Amantadine poisoning. One of them had over 100 tablets. In both cases, the patients actually survived. So I think they can recover. And she didn't have anywhere near those quantities. So I don't think this is actually that realistic.
Seizing. Wilson, need help here?
Oh, that's dangerous. House, you can't die. You have 4 seasons to live for. It's also not the time to seize with the probe in your brain. I mean, most patients, who get deep brain stimulation will develop like a 1% risk of getting epilepsy, but his risk would be much higher after having a seizure if the probe affected other bits of his brain.
House suffered a complex partial seizure. The violent shaking widened his skull fracture, causing a brain bleed. We won't know if there's any cognitive impairment until he's out of the coma. He was right about the Amantadine.
What I love about this episode is the way House's character is constructed is that he's this person who's so negative, hates the world, doesn't care, but actually he always tries to do the right thing for his patients. Like he had that deep brain stimulation done basically to try and save that other patient's life and figure out what the problem is, and putting his own at risk in the process. So really interesting and such a lovable character. He's like a modern day saint in wolf's clothing.
Amber's body couldn't filter it out. Didn't matter if they shocked her or froze her. Her heart was dead once it stopped in an ambulance.
No, this isn't the usual Hollywood ending that we would have liked. And it would just be so rare for someone to die from an amantadine poisoning like this. The most common poisoning, the most common drug overdose is actually acetaminophen or paracetamol if you're in the UK. It can cause liver failure, which you would need via a transplant that we briefly mentioned earlier. One of the really interesting things about transplant though is that if a donor actually gives part of their liver, it's the only organ in the body that can actually regenerate itself to a full-sized working liver again, which is quite impressive, to be honest. Otherwise, people who develop liver failure as a result of poisoning would basically always die because there would be no replacement for it. So people can donate part of their liver and it grows back. Isn't that magical? It's like a Houdini organ.
Hey. You're in the hospital.
What? She woke up? What's happening? Usually a patient who's that unwell with multi-organ failure would not be able to speak, because if all your organs are affected, then so is your brain. But she is on bypass, so that's probably why. This doesn't change anything. I think she's still in a terminal state, and they're basically just going to be saying goodbye. And it's just a machine that's keeping her alive now. The longer that you're on the machine, the less likely you are to survive. The fact she's been on it for almost a week basically says that chances of coming back are very slim anyway, even if the underlying cause was not irreversible.
I have on bypass.
Do you remember what happened?
I got on the bus. I shouldn't have gotten on the bus.
No.
After a major accident, it's so easy for patients or the family to blame themselves for things that have happened, but nobody gets on a bus and expects it to crash, or gets in a car and expects it to crash, or jumps in the swimming pool the wrong way and expects to be paralyzed permanently. You can't blame yourself for these things, but the trauma that people experience is real, and it takes years to get over it. They need deep psychological support from both doctors and psychologists, and friends and family that are around them as well, to be able to get over it. And even after years, sometimes people still struggle to make peace with it for obvious reasons.
I'm dead.
Oh god, this is really upsetting. It's so uncommon that this will happen in real life though. if someone was so unwell that they needed cardiopulmonary bypass and had multi-organ failure, they wouldn't be aware of what was going on around them. The skin would also be yellow still from liver failure, unless it's magically resolved. My God, it's so hard watching this. It reminds me of some of the patients that we've lost after doing surgery, and you know, taking that moment to switch the machine off is really hard. It hits home that you failed that patient, and you know, seeing the way their family reacts, it hurts. But what it does teach you is that, you know, we all have our time, and all we can do is basically spend the time that we're here on this planet being as true to our hearts as possible and trying to do the best we can for people around us and our communities as we can. And this is a really strong reminder to do that. Very powerful stuff. He's awake! House is awake! Oh my God, yes! I don't know if I could have handled much more bad news, so I'm glad.
An empty room and a broken mind. No one calling, no sense of time.
See, the House is just still blaming himself. You can see that, you know, even though he did his best for the patient, he put the deep brain stimulation probe there, he sacrificed a lot. He managed to figure out what's actually wrong with her, made sure she had a peaceful ending, could say goodbye to Wilson. You know, he's still going to have that trauma to go through. It's so tough. Like, how do you come back from that? Well, it's about not being defined by the negative things that happen to you. It's about understanding that everyone fails and everyone makes mistakes. We're human at the end of the day. What else can we do? And every success story starts with failure, and sometimes you need that to get close to success. Sometimes it doesn't feel that way when you lose someone, because that's the end of a specific story. But, you know, who knows why that thing happened? It's like Steve Jobs always says, the stars only align when you look backwards. And sometimes you don't know the meanings of certain problems when they happen. But when you look back 5-10 years in the future, you understand why it did in the first place. So just always, you know, have faith that things will work out for the better. What a tearjerker of a final episode. I hope you found that as interesting as I did. Sometimes, you know, you have to learn to deal with the hard parts so that you can go on to see the good parts of life as well afterwards. And I hope you find it as interesting as I did. If you did, then please let me know your thoughts and feelings in the comment section below. I know that certain themes in this video may have triggered certain memories in some of you. And if you're willing to share those, please let us know in the comment section below. I'm always reading and scanning and trying to reply as best as I can. And if you found this video interesting, check out the House 3 Stories episode there. That one is much less upsetting than this one. So check that out. Take care and look after yourself. Stay happy, healthy.